All right, welcome back to another episode of the Gillett Health Podcast. I'm James O'Hara, nurse practitioner.
I'm Dr. Kyle Gillett.
And today we're going to be interviewing Dr. Kyle Gillett and finding out about his path to this point, how he got from a Texas child to a Kansas City individualized, world-renowned hormone expert physician. So I suppose we'll start the same way that we did mine. We'll talk about your childhood trauma. So I understand that you were homeschooled. So, you must have had zero interaction with any other children, just like myself, and it must have been very traumatic.
Fortunately, I had a lot of interaction. I have two brothers, an older brother and a younger brother. So we were essentially inseparable as we grew up, and we share many, if not all, of the same interests. Even now, it seems like if one of us gets into a hobby, like longboarding or, pick any hobby, all of us will get into it. So we're very close. My older brother is 18 months older than me, and my younger brother is 3 years younger than me. And I actually went through school with my older brother. So sometimes I tell people I was second in my graduating class.
That's funny, and that's a true fact. And I've met your brother. He's a great guy. So I think you could say that about all of the Gillettes. But in any case, so I guess homeschooling, you probably didn't have much of a chance to play sports or do any sort of athletic endeavors. So how did you get into any kind of fitness or health things at all? Because isn't homeschooling just burying your head in a book?
Yeah, for those who don't know, the homeschooling community in the Midwest, especially so in Kansas, but I think just across the Midwest in general, is alive and well, and there's any sport. So you can play anything from volleyball to soccer to football to basketball to pretty much anything that you can think of. And there's debate. I did the geography bee, but I can't even remember the extracurriculars. Junior Master Gardener, 4-H, I did them all. So
yeah, that's actually 4-H is another thing that we had in common. We were plugged in, even though it was a small community where I grew up. Intramurals. I remember my 4-H geology exhibit that I won $20 for. And I think maybe you've told me or your brothers told me about 4-H stories. I guess what were some of your favorite, extracurriculars outside of learning and testing and growing up?
Yeah, I really liked the animals and growing things for 4-H. When I was 7, I had a sheep named Tornado. I actually had a different sheep first, and it was this beautiful small little sheep that had like gray fur, and the person said that it would be a great starter sheep for a 7-year-old. I was actually a kind of unrelated note. I was always relatively like small and behind the growth curve, at least for my age. I just kept growing until I was very old. But anyway, this sheep died because another sheep killed it, and they said, well, the bad news is that your sheep died because a very aggressive sheep killed it. But the good news is we have one sheep left that nobody's claimed, and we'll give you that sheep. And it was, of course, the sheep that killed my original sheep. So it basically just drugged me all around the 4-H ring. And I remember that I was glad that was not the showmanship show, because it was also the biggest. I guess it was a Hulk sheep. We could do a natty or not on that sheep. And it sold for $129. So I'm starting my bank account with $129. And I thought, I liked that. I want to breed animals and sell them.
Interesting. It sounds like that could be either a hero story or a villain story. I think it panned out to the former. But in any case, that's really interesting. So when we talk about, animal breeding and, pets in general, I know that you have two very large and impressive wolfhounds, which you've posted about on social media. Mm-hmm. So, what are some things that, people, it's interesting because it's almost like with dogs, it's that artificial natural selection. You can, over thousands of years, we've selected for different traits. So what are some things that, I don't know a lot about, and what are some things that the audience might find particularly interesting about that field? Because you always come up with these gems.
Yeah, I can talk about dog genetics and dog breeding, animal breeding, probably for literally hours. I specifically don't talk about it around Maddie, my wife, because she's heard all the stories at the same time. But world wars, especially 1 and 2, the main ones, cause a great genetic bottlenecking of purebred, I call them, inbred dog species. And unless you have outcrossing, which is introducing new genetic material, you have high incidences of genetic diseases. Osteosarcoma is a very common one in wolfhounds, and also Great Danes. Mastiffs have their own problems. So each breed kind of has its own unique problems. But there's a project called the Dog Aging Project, and before I was aware of this, I was looking into my wolfhounds, and I came to the conclusion that they needed to be on rapamycin. And there's actually a project, so you can Google Dog Aging Project, and if you have a specific dog breed that has a high incidence of genetically related cancers, this is a study that they're looking at. So I'm interested in, I don't know if you'd still call it public health, but public canine health. So emphasizing outcrossing, strong bred dogs, and maybe I have a little bit of California in me because I consider both of my dogs kind of a rescue.
Yeah, the California thing for sure. So
rescued from a farm just outside the city.
Yeah, and I think that, dogs, pets in general are wonderful. And I mean, as long as you get along with your animal, there's data to support, better stress levels, blood pressure. And then you see people making memes about this when they are holding up this highly aggressive Chihuahua, talking about how good it is for their blood pressure while it's trying to bite them. So anyway, you are a fairly tall, athletic guy now. So I assume that when you went into college, university, you had a full ride scholarship for track and field. I know you're quite the runner, or some sort of athletic endeavor. How did that go?
Yeah, so probably around middle school, I've actually decided, I was probably 12 or 13 at the time. I decided I want to be a doctor. I want to take care of patients holistically. I saw Dad do that at his full spectrum practice, birth to death, and I wanted to help in the same way. So I went for the same scholarship that he had. He went to KU for undergrad, and I was going to get the same scholarship. So I met all the criteria. I got all the right scores and whatnot. And that's all I was going to do. I had not a ton of interest in sports. So I also thought about going to what's called a 6-year program. So in the podcast that we had with you, you kind of talked about the risk and benefits of requiring a BSN for nurses. And in a lot of countries, people don't go to undergrad and then med school. A lot of times you go straight to med school. Some MBBS programs are like that. But in order to become a medical doctor, in most countries, it does not require that college experience. But since I had started school with my older brother, who was a year and a half older, I was 15 and I was done with all of my high school classes and I was ready to go to college. So I thought I'll either go to JUCO for a year, cheap, or think about going to KU or UMKC, the two big colleges. So I visited both of them, and I realized that although I was a very mature individual and I already had full-time jobs, I just did not fit in whatsoever with the people that were doing that. Otherwise, I would have gone to 6-year med school.
So to let that sink in for people, you were 15 at this time, and a 6-year program would have put you at graduating medical school at age 21. Is that right?
Yes. So that would have been a very different life trajectory. And I believe that I think that God led me in a different direction and that I needed kind of that more holistic development in and of myself. Not necessarily the social development, but the mental development of being ready to encounter human nature of all sorts, if you will.
Yeah, that's pretty profound. So at 15, you already had this sense of like this high, emotional intelligence to see like, oh, these people are probably not, this probably isn't a suitable environment for me. And kind of knowing, hey, maybe I, don't take the fastest possible route to becoming an MD, but I take a little bit of time, have some growth, do things that I like to do. Are there any experiences that you would attribute this or things that your parents instilled in you? Or what do you think accounts for that level of like maturity, not just like book intelligence, but also emotional intelligence at 15 years old?
Yeah, I think a lot of it was just being raised with my brothers, especially my older brother. I was asking my grandpa, who's a pilot, about what the most important things about having a life that is like, having self-actualization in life. And he said, surrounding yourself with good people. And good does not necessarily mean like good at their jobs or just like likable, but people who are kind of in the same boat as you, and you can push each other forward. So that way you're all in the same boat and you're all rowing the same way at the same time and being coordinated with that. And I think that's what I've done in other aspects of my life as well. But it's very easy, just like if you look at younger siblings, when they see their older sibling playing a sport, basketball, for example, then it is just literally easier for them to get to that same level at an earlier age. Kind of pulls you along for the ride.
Yeah, you kind of have that, cuts the learning curve, or you have an accelerated trajectory and those sorts of things. So if you're always competing against someone who is more, physically advanced, then your skills are just going to develop faster. Same thing when people want to improve in, like, say, chess, right? You want to play against someone who's not easy to beat every time. You won't get any better.
Yep.
And you mentioned something earlier about, growing slow, and then you grew for a long time. So was this something that you were, I guess, medically interested in even at a young age? Or I assume that, you had some, passive learning of, medical things with your father being a family medicine doctor.
Yeah, not from a very young age. I probably became most interested in it around age 18, after I started college. I didn't think a lot about it, but I definitely grew several years, like my growth spurt was several years after most of the other people my age. And some of that's just familial. I think some of it has to do with like a relatively low aromatization rate, like low estrogen, which has kind of a very persistent problem. But I think one of the times that I became more interested in my personal health is when I went to the doctor. I had a couple different doctors, Dr. Church, Dr. Rado. But anyway, I got an exam just like I should. And I was probably 18 or 19. And they said, oh, well, you have varicocele. And I said, well, yes, I'm aware that's developed. And they talked about fertility and they talked about hormones. And I think they did a good job of actually talking to me. Perhaps also because they're friends with my dad. But that definitely spiked a bit of an interest in, I guess, health optimization. I guess in addition to that, it also made me think about my health a lot. So I'm always thinking about each aspect of my health, probably a terrible patient. And a lot of people, including my wife, call me a hypochondriac. So maybe that gives me some, I don't know if I would call it better empathy, but it definitely gives me a different type of empathy.
Interesting. For a hypochondriac, I think you are a little overdue on some blood work. So we'll chat about that. But in any case, that's really interesting because it sounds like they did a really good job of not, totally dismissing this finding. Hey, don't worry about it. Don't think about it again. But also not making it a traumatic experience where it's like you will have terrible health because of this. Your entire identity is tied to this one, finding one condition that you have.
Yes.
So interesting that it's sort of started this hormone sort of trajectory, because you can't really talk about the sequelae of that without addressing, the hormonal factors that are influencing this. So I assume, well, let me just ask you, did you consider going into endocrinology, or did you have any input from, Dr. Gillett, your father, on as to, where you should go and how you should navigate medical school, like how to get into this program or this residency or these fellowships and all these sorts of things?
Yeah. After 13 or 14, my interest has not wavered. It's always been be a family doctor, full spectrum, deliver babies, care for people when they're old across the entire lifespan for the whole family. And I've always also known that I wanted to do concierge medicine. So I knew that I wanted to do a really good job and not be limited in the constraints of time. Not a ton of input family-wise, like not too much pushing one way or another, but a lot of people in the medical community where I went to med school very strongly advised me not to go into family medicine.
And why do you think that is?
It's because in general, if you are like if you're a better qualified applicant, you go into a specialty that on average pays more. And that is one of the only reasons family medicine doesn't have a significantly worse burnout rate. Neurosurgery has the worst burnout rate and the least satisfaction rate, and also coincidentally the most hours a week. I think it's 70 something hours a week on average for a neurosurgeon. But that's one of the main reasons. And this was also me going to a medical school that heavily emphasized primary care. So, the dean of student affairs, who was excellent while I was there, he never emphasized or tried to convince me to go into a different specialty. But pretty much every resident and other medical student that I talked to did.
I see. And that's because I think people are looking at not necessarily what is most congruent with what goals you have, or what type of medicine you want to practice, but just looking at the data in terms of if you can have X amount of dollars, you have X amount of quality of life. And if you look at those distribution charts of the average annual salaries, you see that, the specialties tend to make significantly more than someone who's doing internal medicine, family medicine, pediatrics, which arguably should be the foundation of health if we're looking at a more preventive approach or an individual approach, as opposed to, catching up with things on the tail end. And this is something where I might differ in my opinion to some people with a lot of nurse practitioners just going into the primary care environment, especially if that's family where you have newborns to 90-year-olds. Because in my mind, that requires the largest breadth and depth of knowledge, because you have the most potential to see the most number of different diagnoses compared to if you're in a cardiology clinic, for example. You're going to see more of the rare things, but there's kind of a finite amount of things that you see in each of these specialties, as opposed to if you're a family medicine physician, you have to be prepared and know all these different things in each and every specialty. And sometimes that does mean, referring these things, but sometimes it means treating these things and then referring them to a specialist secondary to getting someone stabilized, sort of.
Yeah, I agree. It is a legitimate public health concern. And we'll talk about this with Taylor as well, that the current model does not put its money where its mouth is. So in order to emphasize primary care and preventive medicine, then you need to compensate the people who do that adequately in order to emphasize a lot of your best applicants going into these specialties. That's a bit of an aside. We don't need to talk about public health too much at this point, but I do think that one of the things that helped me overcome that, again, is the experience with all the different, I guess you can call them side gigs or jobs. So whether it's breeding giant silk moths or selling breeding fish and selling back to the pet store, growing vegetables, or maybe even mowing lawns, I kind of had this unconscious knowledge that I can do whatever I like and then monetize it, which is kind of the opposite of what someone I think it's Mike Rowe, talks about. At the end of the day, you need to provide for your family and do something that's going to be able to provide from your family. Mm-hmm. But because I started working and saving, and that's another thing we have in common, is if we took a student loan, I don't think you did, I think I did, pay them off as soon as possible. So even after residency, when I was already board certified, I had my MD, lived with my parents for almost a year, even with a newborn and a pregnant wife, in order to work as hard as possible to pay off the loan. I had to take loans for med school, not for college. But that's just a very stark contrast to a lot of people that you need to plan from a very early age if you're going to be able to do something that you love. So what I'm doing now is if there was no money, I would do the exact same thing and it would just be a hobby.
Yeah, I totally agree with that. And I remember having the same kind of rationalization where it's okay, I could get a federal student loan. And in hindsight, having received a Pell Grant, could have potentially have gotten that forgiven. But, I don't lose any sleep over that. I don't really think about it. But I was okay, I can just pay, $2,000 per month and pay my tuition instead of borrowing and accruing interest and all these sorts of things.
Yep.
And then I was like plugging that into, at the time, like a mortgage calculator. And I was like, wow. I was like, that buys like a $500,000 house. And I'm like, I don't need that. So I would just like put this money into paying for probably not a $500,000 house anymore. But at the time, that's what it could buy. So I remember having those things where you and I think, are both very frugal and financially responsible, and kind of mapped out our way. So when you went to med school, and you talked about having these different hobbies, how would people describe Kyle Gillett as like the person that fill in the blank, or most likely to fill in the blank?
One of my very good friends and roommates said, Kyle's goal in life is to have as much fun as possible.
Yeah, I think that's accurate. We certainly work hard, but we certainly play hard and have a lot of fun as well. So, and we have fun while we're working. So that's a fantastic way to live your life, really, I think. And then I understand you also, and I've heard you talk about this on podcasts. So cutting and coloring hair, you may not have had the credentials to do this, but
I was not a credentialed esthetician or cosmetologist.
So cosmetologists would have called you a quack at the time.
Yes,
because
I was an unlicensed individual. But in most cases, I did not receive any sort of payment.
So this was another frugal decision. You were helping out your colleagues in med school to have a nice sharp cut without burning through lots of money to do so.
Yes. But that's one of the reasons why I love aesthetics. I liked to cut and color men's and women's hair. And, there's something immediate about that. And it's something that's tactile as well. I think it's transitioned nicely into our aesthetics practice.
Yeah, it's nice to have, when we talk about the art of medicine, you hear that term all the time. And now there's even this art, there's the like subjective side to it. There's the objective data. And then there's also technology. And our colleague Taylor really summarized this well, because it's this, marriage of medicine and technology. So you've got the art, the science, and the technology now. And you really can't separate those two. Unless you're just running everything through the USPSTF guidelines and taking 27 hours per day to deliver guideline-driven care. I saw a headline about that the other day that Taylor and I chatted about. I think it was looking at if you took the time and you just went and looked up these guidelines and did everything that you were supposed to do for every single condition people have, that it takes a substantial amount of time to actually deliver guideline-based care.
Yep. Yeah, that's a good way to look at it.
All right. Is there anything else that I should ask you about?
I guess we could talk, I'm married as well. So
that's right.
We have something in common.
So Kyle, are you married?
Yes. Yeah. It's a question that we do get. If you type in Kyle Gillett, I think Kyle Gillett wife pops up.
Yeah. So how did you meet your wife?
Yeah. We met in Springfield, and 3 months later we were engaged. And then 3 months after that, we eloped to Hawaii. We were married.
Interesting. And this is something else that we have in common.
Yeah.
My wife and I also eloped to Hawaii. And what was the year that you got married in Hawaii?
Ooh, don't put me on the spot. 28. Wait a second. 2018?
That's the same year that my wife and I eloped, and we're also married in Hawaii.
Yes, I think it was the same year. Yeah. June.
September.
Nice. Pretty good.
Yeah. So we just missed each other in passing there.
Yep.
It's really interesting. So you met your wife in Springfield, Missouri, eloped to Hawaii, and then you've got a couple of really athletic boys, don't you?
Yeah. We have 2 boys. Ozzy just turned 3, and Archer is 1.5. So they work out with me, and they're pretty crazy. They tend the chickens. We have 1.5 acres and big gardens, of which mostly Maddie tends to. Grant's also a green thumb, as you may have talked about on the podcast you did with him. But definitely spend a solid amount of time doing that. It's kind of a nice break from, I know you've talked about how school is a break from work, work's a break from school. Family life is kind of a break from work, and then work's kind of a break from family life too.
Yeah, it's nice to break things up into chunks like that. So you have your work life, which is also social, but then you have your social life where you're not actively working, and then you have your family life and quality time. And I think that's focusing on quality time for myself and my wife has been a really positive thing for us in our relationship.
Yep.
So, it's just kind of structuring your life in a way that's going to, or I guess, building your own algorithm to get to the end result that you want to be.
Our social life is pretty similar too. We both like to be around people 100% of the time.
Yeah, we talked about this because there's different levels on like the spectrum, right? Some people are more labeled as introverts, and they have kind of a, they get their dose of socialization and they kind of retreat back, and they really enjoy that peace and, just, cuddling up with a book or something of that sort.
Yep.
And for myself, I think if I'm looking at like every activity that I could be doing, even if it's reading a book, like if someone else is reading the same book at the same time, which maybe we'll get there with Neuralink someday, and we can share thoughts between that. I think that's something that I wouldn't be like, no, I need to do this like on my own, or listening to some of our favorite podcasts. It's like that could be a social activity. A lot of times I'm just driving by myself when I'm listening, but I'm like, oh man, I'm going to have to like talk to Kyle about this or tell my wife about this, because I hear things that I think are interesting. Fact check them if they sound particularly too good to be true a lot of times, and then try to disseminate those things to friends, family, and our audience now. I wouldn't change anything.
Yeah. I think our bachelor lives have some similarities as well. So meal prepping a lot of chicken, driving very old cars, living in very frugal locations, maybe not beneath, like in a wine cellar or on the floor in the basement, but
yeah, my first apartment was $300 per month. I think we both still we drive older but a little bit more reliable vehicles now.
A little bit.
Safety is a bit more important when you have a family.
I still miss my van.
Yeah, and chicken and rice. I remember meal prepping just chicken and rice because I read about weightlifting and bodybuilding, and that was something that I could like, okay, even if I only have like 30 minutes or 45 minutes in my day of spare time, it's like I can do this. It's going to be good for my health. I can eat healthy foods. Those were things that I had control over when I was just kind of being passed back and forth, work and school and work and school. So I think it's important for people to find something like that, a sense of control. So meal prepping, how far in advance were you meal prepping at any one point?
Depending on how discounted the chicken was at Walmart. So, if it was like 99-cent chicken breast, I think I got 60 pounds at one point.
That's a lot of preparation.
That's a long time.
Yeah.
Big freezer.
Yeah. Deep freezer is a great investment for anybody out there who wants to stock up on whole foods that you can freeze and store for a long time. I think they're great. But yeah, I remember, I had once a week, I would just prep out everything. Maybe that's a little bit too far for some people, but for me, I'm like, this is the time I have, and that system worked. And the first time that my wife now, but girlfriend at the time, came over to the apartment and saw this mountain of Tupperware dishes that needed to be done, because I also did those once a week. She thought, oh no, we're going to have to put James in a home. He can't take care of himself. He can't take care of his apartment.
Yeah.
But that was strategic.
Yeah. That would be sad if you had to go to a home. I think I remember my house had no floors, only subfloors. And I had either no utensils or I think I just had paper plates and then actual utensils. And that was pretty much all I had in the house. But I was an intern in residency, so that kind of makes sense. I just wasn't there.
Yeah. And do residents get free food? Because I know there's these doctors' lounges in the hospital where nurses can't go, but I see people used to see people coming out with all kinds of goodies.
Yeah. I don't know if it was even it was probably halfway through the first year until halfway through the second year. Definitely gained some weight. Or maybe it was second year to third year. Yeah, I probably gained about 30 to 40 pounds of bad weight during residency. And right around the time that we had maybe it was sympathy weight, right when we had our first son, I noticed that I had that. And then I went on a 0 liquid calorie diet. I ate my Greek yogurt, my spinach, my carrots, low calorie dense foods that I liked. And I started exercising more and got that off. But that was definitely an odd experience, given that I had not experienced, I haven't gone through that before. So now I have. Interesting.
Yeah, I would say that my nutritional mistake, and maybe even someone asked me this question the other day on a podcast, that if you could go back to your 20-year-old self, what would you tell yourself? And I would probably say that the Pop-Tart bulk wasn't a great idea. I don't think that Greg Doucette had invented main gaining yet.
No.
So I thought you had to eat a lot of calories to get big and gain muscle. And the other piece of advice would have been to myself to check some blood work, because it probably didn't look so good at the time.
Probably not. Yeah, around that time, I remember making protein ice cream. I saw the video. Greg Doucette had a video. I think he's taken it down now. It was one of my favorite ones. But anyway, I made my anabolic protein ice cream. Those low-calorie dense foods really helped. We used to do Coach Greg and Chill. Maddie and I would. And I think both of us would watch Derek, More Plates, More Dates as well. These are kind of tangential channels with Greg Doucette. And that's kind of how we got connected as well. Yeah,
I remember this is probably back, when I was in high school, I think, when like More Plates, More Dates came out and was a thing. And then these self-improvement forums. I remember Chris, can't think of his last name right now. Yeah, Diodes was putting out content, and I was like, oh, like self-improvement, lifting weights. I was like, this is something that seems like it can only benefit me.
Yep.
Depending on how far you take it. Obviously, I didn't become a professional bodybuilder because there's less of an ROI on that sort of investment. Yep. But the same question for you, I guess, if you were looking back at Kyle Gillett at age 20, would you change anything? Would you give yourself any advice? Or would you just continue the current path?
Yeah, I think I would have implemented various things earlier in life than I did. So when I was 20, I'd really never lifted weights, and I didn't think about my diet. I didn't think about trans fats. I didn't think about liquid calories. Just implementing the things that I have a little bit earlier. So probably nothing too major. I do remember one particular funny story when I think it was before Maddie and I were married, and I was trying to explain why I had ketoconazole shampoo despite not having a fungal infection. So that was a funny time.
Interesting. Yeah, I remember when the big 3 stack sort of came out for hair loss prevention, and I guess I thought I was immune to that until I was about 22, and then I was like, the story that everybody hears, it's like, oh, you start noticing it here and there, and you're like, oh, maybe it's just the lighting, but I am not immune to male pattern baldness. So I think we all have that. Well, not all of us, but most of us have that
almost
point in time.
Everyone.
Maybe when someone's in their 20s, maybe when someone's in their 50s. There's a few lucky ones out there that the Norwood Reaper leaves alone, right?
Yep, very lucky. I'd like to see why, because there's many different types, but that's kind of another topic. We'll have a hair loss podcast if it's not posted before this one.
Yeah, that's right. No, I think this has been a really insightful podcast. People kind of get to know Dr. Kyle Gillett a little bit, and not just the wonderful knowledge and information that you put out. So anything else that we need to chat about?
I think that's it. Thank you for listening.
Yeah, thanks so much for tuning in to meet Dr. Kyle Gillett, and may God bless you with happiness and healthiness.